Diabetes, a word that resonates with millions worldwide. It's a condition as ancient as it is modern, affecting lives from the days of ancient Egypt to the high-tech era of continuous glucose monitors. Today, we journey through time to uncover the fascinating history of diabetes, exploring how our understanding and management of this condition have evolved over centuries. Ancient references to diabetes. A. Early observations in ancient cultures. Our story begins over 3,500 years ago in ancient Egypt, where the earliest known reference to diabetes appeared in the Ebers Papyrus. Physicians described a mysterious condition marked by too great emptying of the urine. Little did they know, this was one of the earliest observations of diabetes. Around the 6th century BC, ancient Indian physicians documented madhumeha, meaning honey urine. They noted how ants were attracted to the sweet urine of individuals with this condition. Ayurveda recommended natural treatments like a balanced diet, physical activity, and herbal remedies, principles still relevant today. In China, diabetes was known as xiaoke, or wasting-thirsting disease. Traditional Chinese medicine employed herbal formulas and acupuncture to manage symptoms, showcasing early integrative approaches to health. The Greeks and Romans also took note of this illness. Greek physician Aretaeus of Cappadocia, in the 2nd century AD, coined the term diabetes, meaning siphon, to describe how the body seemed to pass fluids through like a funnel. Unfortunately, treatments remained elusive until much later. Case studies. Early diabetes management. Case study 1. Traditional treatments in ancient India. Ancient Indian physicians treated diabetes with dietary control, herbal mixtures, and physical exercise. Historical texts mention how patients who adhered to these regimens had better health outcomes, a principle that echoes in modern diabetes management. Case study 2. Early Chinese medicine techniques. Chinese practitioners focused on balancing the body's qi through herbs and acupuncture. One documented case involved a patient who managed symptoms effectively by combining diet, exercise, and acupuncture, showcasing an early holistic approach. Global impact of diabetes. A. The economic and social costs. Diabetes affects over 400 million people worldwide. The economic burden includes healthcare costs, lost productivity, and the impact on families. Countries like the USA, India, and China have implemented national strategies to address the diabetes epidemic. B. Healthcare system strain. Hospitals and clinics are increasingly focused on managing diabetes and its complications. From specialized diabetes centers to public health initiatives, the fight against diabetes is a priority globally. C. Education and prevention programs. Public health campaigns like the Know Your Numbers initiative encourage regular blood glucose testing and healthy lifestyle choices. Such programs have proven effective in reducing the incidence of diabetes-related complications. Practical applications. Modern management of diabetes. A. Advances in medication and technology. Today, managing diabetes involves more than just insulin. Medications like metformin, SGLT2 inhibitors, and GLP-1 receptor agonists offer more tailored treatments. Technologies like continuous glucose monitors, CGMs, and insulin pumps have revolutionized care. B. Nutrition and lifestyle management. Modern nutrition science emphasizes the role of a balanced diet and physical activity in managing diabetes. Programs like the DASH diet and carb counting help individuals maintain stable blood sugar levels. C. Future innovations. Hope for a cure. Research into stem cell therapy, beta cell transplants, and artificial pancreas systems offers hope for the future. Scientists are working on treatments that could one day make diabetes a thing of the past. From ancient texts to advanced technology, The history of diabetes research is a story of progress and perseverance. While challenges remain, the future is bright with possibilities for a cure. At BootDiabetics, we are dedicated to supporting everyone on their journey to better health. For more insights, expert tips, and diabetes-friendly resources, visit www.bootdiabetics.com. Together, let's continue the journey toward better health and a brighter future. Artificial intelligence, or AI, is not just a buzzword. It's revolutionizing healthcare, including diabetes management. From predictive analytics to personalized treatment plans, AI offers new hope for millions of diabetics worldwide. Today, we explore how AI is transforming diabetes care and what the future might hold. Current applications of AI in diabetes management. A. Predictive analytics for early diagnosis. AI-powered algorithms analyze vast amounts of patient data to predict the likelihood of developing diabetes. By identifying patterns and risk factors early, AI helps healthcare providers initiate preventive measures before symptoms appear. B. Personalized treatment plans. AI technologies like continuous glucose monitors, CGMs, and smart insulin pens provide real-time data that allow personalized treatment. These tools integrate with apps to adjust medication, recommend dietary changes, and even predict blood sugar fluctuations. C. Enhanced diabetes education and support. AI-driven platforms offer 24/7 support through chatbots and virtual assistants. These tools answer questions, provide reminders for medication, and offer educational resources tailored to each patient's needs. D. Remote monitoring and telemedicine. For those with diabetes, regular monitoring is crucial. AI-powered wearables and telemedicine platforms enable doctors to monitor patients remotely, ensuring timely interventions without the need for frequent clinic visits. Case studies, success stories with AI. Case Study 1. Google's DeepMind and early detection. Google's DeepMind uses AI to detect early signs of diabetic retinopathy by analyzing retinal scans. This breakthrough has helped prevent vision loss in many diabetic patients by facilitating early treatment. Case Study 2. The impact of AI in insulin management. Companies like Medtronic have developed AI-powered insulin pumps that predict blood sugar drops and adjust insulin delivery automatically. These smart devices reduce the risk of hypoglycemia and improve the quality of life for type 1 diabetics. Future predictions. The role of AI in shaping diabetes care. A. Towards a cure, AI and medical research. AI is accelerating research into diabetes treatments and potential cures. Machine learning models analyze genetic data to identify new drug targets and streamline clinical trials, bringing life-saving therapies to market faster. B. Precision medicine and personalized therapies. In the future, AI could analyze individual genetic makeup and lifestyle data to create highly personalized treatment plans. This precision medicine approach could help manage or even reverse type 2 diabetes through targeted interventions. C. Smart homes and daily diabetes management. Imagine a home where your refrigerator suggests diabetes-friendly meals, or your wearable device alerts you to take a break and exercise. AI could seamlessly integrate diabetes management into everyday life, making healthy choices effortless. 10 inspiring diabetes success stories, real-life case studies. 1. Sarah's journey with smart insulin pens. Sarah, a type 1 diabetic, struggled with managing her blood sugar levels until she started using an AI-powered smart insulin pen. The device helped her predict glucose trends, significantly reducing her risk of hypoglycemia. 2. John's transformation with continuous glucose monitors. John experienced frequent blood sugar spikes. With a CGM, he received real-time alerts and learned how specific foods affected his glucose, leading to better diet choices and overall stability. 3. Maria's newfound freedom with an artificial pancreas system. Diagnosed with type 1 diabetes as a child, Maria gained independence through an artificial pancreas. The AI technology automatically adjusted insulin levels, giving her peace of mind, especially during sleep. 4. Tom's success with AI diet coaching. Tom, a type 2 diabetic, used an AI-driven diet app that analyzed his intake and provided personalized meal suggestions. His HbA1c levels improved dramatically within a few months. 5. Elena's predictive analytics experience. Elena used a program with AI to predict the likelihood of diabetes-related complications. The insights helped her and her doctor develop a proactive health plan, avoiding potential health crises. 6. Paul's safety through remote monitoring. Through AI-based remote monitoring, Paul's healthcare team identified early signs of diabetic ketoacidosis. Timely intervention prevented a potentially life-threatening situation. 7. Community impact in rural India. An initiative in rural India used AI tools to screen for diabetes. Early detection and education significantly reduced health issues, showcasing how technology can reach underserved populations. 8. Lisa's smart home integration success. Lisa connected her diabetes management tools with her smart home system. AI-driven reminders for medication, exercise, and meals helped her maintain a healthy routine seamlessly. 9. Michael's breakthrough with machine learning insights. Machine learning tools helped Michael identify lifestyle patterns affecting his blood sugar. Adjusting his habits led to remarkable improvements in his overall health. The psychology of dealing with diabetes, emotional well-being, and coping strategies. Understanding the emotional impact of diabetes. Living with diabetes involves more than just managing blood sugar levels. It also brings a range of emotional and psychological challenges. From the initial shock of diagnosis to the ongoing stress of daily management, diabetics often experience feelings of anxiety, depression, and burnout. Understanding these emotions is the first step toward building resilience. Common psychological challenges faced by diabetics. Diabetes distress. A specific emotional response to living with diabetes, characterized by feeling overwhelmed by the demands of managing the disease. Anxiety and fear, concerns about potential complications, hypoglycemia, or managing diabetes in public settings. Depression. People with diabetes are more likely to experience depression, which can interfere with self-care and disease management. Burnout. A state of exhaustion from the relentless nature of diabetes management, leading to neglect of blood sugar monitoring or treatment regimens. Effective coping strategies for mental well-being. Mindfulness and stress management. Practices such as meditation, deep breathing exercises, and yoga can reduce stress and improve mental clarity. Establishing a routine. Consistent daily routines for meals, medication, and exercise can reduce uncertainty and promote stability. Setting realistic goals. Instead of striving for perfection, focus on achievable health and lifestyle goals. Building a support network. Engaging with support groups, whether in person or online, can provide comfort and practical advice from others who understand the diabetes journey. Seeking professional help. Therapists and counselors, particularly those specializing in chronic illness, can help diabetics navigate complex emotions and develop healthier coping mechanisms. The role of AI in supporting mental health. AI technology is increasingly playing a role in mental health support for diabetics. Apps offer features such as guided meditation, helping manage stress and anxiety, mood tracking, monitoring emotional patterns and offering insights. Virtual support groups, connecting diabetics with communities where they can share experiences and encouragement. Practical tips for maintaining emotional balance. Celebrate small wins. Recognize and reward yourself for managing your diabetes. Even small achievements matter. Educate yourself. Knowledge about diabetes management can reduce fear and increase confidence. Stay active. Physical exercise is not only good for blood sugar control, but also boosts mental health by releasing endorphins. Stay connected. Regular social interactions, whether with family, friends, or support groups, reduce feelings of isolation. While diabetes presents ongoing challenges, focusing on mental health is crucial for overall well-being. With the right tools, strategies, and support, living a full and vibrant life with diabetes is not only possible but entirely achievable. At BootDiabetics, we are committed to providing resources and support to help manage both the physical and emotional aspects of diabetes. How to help aid someone with diabetes. Practical tips, supportive strategies, and real-life case studies. Introduction: Why support matters. Supporting someone with diabetes involves more than just understanding their medical condition. It requires empathy, patience, and a willingness to help with both physical and emotional aspects of managing this chronic illness. Whether you are a family member, friend, or caregiver, your support can make a significant difference in their quality of life. 1. Educate yourself about diabetes. Learn the basics. Before offering support, it is crucial to have a solid understanding of diabetes, including the different types, symptoms, and treatment approaches. Type 1. Diabetes. An autoimmune condition where the body attacks insulin-producing cells in the pancreas. Individuals with type 1 need insulin therapy for life. Type 2. Diabetes. A metabolic disorder where the body becomes resistant to insulin or doesn't produce enough. It can often be managed with lifestyle changes, oral medications, and sometimes insulin. Gestational diabetes. Occurs during pregnancy and usually resolves after childbirth, but may increase the risk of developing type 2 diabetes later in life. Stay informed. Research regularly. Follow reputable sources such as the American Diabetes Association, National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, and BootDiabetics. Understand blood sugar management. Learn how diet, exercise, medication, and monitoring play roles in maintaining healthy blood sugar levels. Familiarize with devices. Understand how tools like blood glucose meters, continuous glucose monitors, CGMs, and insulin pumps work. 2. Assist with daily management. Help with routine tasks. Supporting daily management involves both practical help and gentle reminders to stay on track with their diabetes care plan. Meal preparation. Cook balanced, diabetes-friendly meals with a focus on low glycemic foods, whole grains, lean proteins, and healthy fats. Exercise encouragement. Engage in activities together, such as walking, cycling, or joining a fitness class to make physical activity enjoyable and less of a chore. Medication management. Help organize medications, whether through a pill organizer, setting up reminders on a phone, or using an app designed for chronic illness management. Be prepared for emergencies. Recognize warning signs. Learn the symptoms of hypoglycemia, shakiness, sweating, confusion, and hyperglycemia, frequent urination, increased thirst, fatigue. Know what to do. Carry emergency supplies like glucose tablets, snacks, or an emergency glucagon kit, and know how to use them if needed. Create an emergency plan. Have clear steps for what to do in case of a diabetic emergency, including contacting their healthcare provider or emergency services if needed. Case study: supporting daily management. Emily, a college student with type 1 diabetes, struggled to maintain a balanced routine between her studies and diabetes management. Her roommate Sarah helped by preparing healthy meals and setting reminders for Emily to check her blood sugar. Sarah's support significantly reduced Emily's stress, allowing her to focus better on her studies. 3. Provide emotional support. Be a good listener. Living with diabetes can be emotionally taxing. Listening and offering a non-judgmental space for them to express their feelings is invaluable. Acknowledge their feelings. Validate their emotions, whether they feel frustrated, tired, or anxious about their health. Encourage expression. Ask open-ended questions like, "How are you feeling about your diabetes management lately?" Support mental health. Encourage professional help. Suggest talking to a therapist, especially those who specialize in chronic illness. Engage in relaxing activities. Activities like yoga, meditation, or hobbies can help manage stress and improve mental health. Promote a positive mindset. Remind them of their successes and progress, even if they seem small. Book case study. Emotional support. Michael, a father of 2, often felt overwhelmed managing his type 2 diabetes. His wife encouraged him to join a support group, where he found solace in sharing his experiences and learning from others. This sense of community improved his outlook and motivation to manage his health effectively. 4. Promote a healthy lifestyle. Make healthy choices together. Collaborative meal planning. Work together to create meal plans that are not only healthy but also enjoyable and sustainable. Active living. Join them in physical activities, making exercise a shared and enjoyable part of the day. Create a positive environment. Avoid temptations. Keep sugary and unhealthy foods out of shared spaces or offer healthier alternatives. Celebrate healthy choices. Reinforce positive behaviors like choosing water over soda or preparing a healthy snack instead of grabbing fast food. 5. Respect their independence. Offer help, but don't overdo it. Balance assistance and autonomy. Support their efforts without taking over their diabetes management. Encourage them to handle tasks independently, offering help only when needed. Respect their decisions. Everyone manages their health differently. Instead of insisting on your approach, ask them how they prefer to manage their care and support those choices. Book case study. Encouraging independence. Linda, whose teenage son Mark was recently diagnosed with diabetes, found it difficult not to take over his care. However, by gradually giving Mark more responsibility and trusting him to manage his condition, she noticed a boost in his confidence and better management of his health. Conclusion: the power of support in diabetes care. Supporting someone with diabetes involves understanding, patience, and a proactive approach. Your role as a friend, family member, or caregiver can significantly impact their physical and emotional well-being. By offering practical help, emotional support, and promoting independence, you empower them to live a healthy, balanced life.